Brampton Mayor Patrick Brown has announced the city will advocate to treat more people with brain injuries, mental illness, and severe addictions against their will. Chris Glover was on hand for the announcement. Chris, it is controversial. A call to action. Would it require, though, legislative changes?
It absolutely would require provincial legislative changes, and that's exactly what Mayor Patrick Brown is calling for today. He wants to empower first responders to put people into psychiatric facilities if deemed necessary by a doctor, and only in those extreme cases of severe addictions, brain injuries, and mental illness as well. Patrick Brown says that the need for this is quite clear when you look at what's playing out on the streets of Brampton and many municipalities across the province of Ontario. When you look at the opioid overdose deaths that we continue to talk about, as well as encampments and the homelessness crisis that is in so many communities. Patrick Brown was talking specifically about here in Brampton, and he cited some numbers for us. Back in 2010, mental health ER visits have surged from 2010 to now by 121%. And he also said that in Peel Region, in the last 5 years, 705 people have died from the toxic drug supply. So Patrick Brown says that the current voluntary system of treatment is not working. That's why he's advocating for Brampton to be a part of a pilot program to introduce this involuntary treatment system. And he's looking at British Columbia, where just last month they instituted something very similar to this, involuntary treatment programs now beginning in some places, including in correction facilities as well. But the Canadian Civil Liberties Association says that this could be an infringement on people's rights. It could also be unconstitutional. I put that to Patrick Brown as well as one of the councillors here in Brampton. Here's what they had to say.
Well, certainly what has been presented in BC could be tested in the courts, and I think there is an indication that it will. But we simply can't accept hundreds and hundreds of preventable fatalities. And, you know, we've obviously been doing extensive consultation on this with those that are working in this space. And, you know, one response I was given is if someone's in the midst of a heart attack and is not able to explain they need to go to the hospital, you're still taking them to the hospital for treatment. And, you know, there are individuals who are on the verge of fatality that desperately need treatment. And, you know, as a society, are we going to allow more and more of these preventable fatalities?
This treatment should be seen as a last resort, used only when an individual poses a serious threat to themselves or others, and when less intrusive measures have been completely exhausted. Respect for human dignity is paramount. Compassionate intervention should focus on rehabilitation and reintegration rather than punishment or control.
So will the Ontario government make this change to the Mental Health Act? I put that question into the government today, and they sent me a statement saying that their current priority is to connect people who want treatment with the care that they need. Yet yesterday, Premier Doug Ford had this to say.
We're looking at it. I know my minister, Michael Tabolo, is a big fan of it, but we have to look into it pretty deep. So I'm always open to any idea.
And so certainly there are those concerns around whether this infringes on people's rights. There's also concerns about whether or not this would lead to forced institutionalization, rounding people up and putting them into facilities. A psychiatrist that we spoke to at Camp H also is concerned about the effectiveness of all this.
I think this solution is a little bit too simple. These are complex issues, and they require, unfortunately, complex solutions. And simply turning around and saying we wave our legislative wand and put people in treatment against their will and poof, everything works out. It just doesn't work like that, I'm afraid.
And Dwight, he said that the better approach here would be to beef up the mental health supports that already exist in the province of Ontario.
Yep, something needs to be done. Thank you, Chris.